What we see in the long run is to have our own researchers with our people. But that needs to be developed, and it also has to be planned, and part of the future for that is to train our own people. And the North will speak for itself. The data will be there, the training, and we'll have our own people as researchers, which will be designed from each community. And that way the communities will have something that they own. It's ownership to the communities.
The Yukon First Nations Health Promotion Planning Spring School was developed collaboratively by the Council of Yukon First Nations, the University of Toronto, the Arctic Health Research Network Yukon, and Yukon College.
The Arctic Health Research Network Yukon has been engaged in discussions with the Yukon First Nations throughout the territory in regards to health research priorities. From those discussions, it was quite evident that capacity building was to be developed in the communities.
The idea came from Dr. Suzanne Jackson from the University of Toronto from a presentation that she made to the Council of Yukon First Nations Health and Social Development Commission. Her presentation outlined a 6-step approach to health planning, and the Health Commission thought it was a great idea and decided to move forward with having a course.
People recognize that for them to be controlling their own health programs, they need to be able to have access to information. And information doesn't grow on trees. Information has to be obtained, and one way to get it is through research.
In the health field, and especially in our communities where health issues are huge, they're big things that we have to conquer and overcome, and there's a lot of issues that we have yet to deal with.
I'm a co-investigator on this team grant that Q Young has with the Canadian Institutes of Health Research. And part of that team grant is to bring some researchers together from different parts of Canada to focus on research in the circumpolar area in the north, and particularly focused on chronic disease prevention. So one of the roles that I'm playing as a health promotion expert is to work on the prevention side of chronic disease, and also on how to take knowledge and research and translate that into action in the community, because that's what health promotion is about.
When you start on this healing process, you need somebody there to hold your hand when you need them to hold your hand. So this was our core. And then
having a concise model, a very logical model like this one, where you are developing a core and you're working out from a core outwards, and it is almost necessary, especially when we are fighting with a lot of capacity issues in our communities. Especially in my community, we've got a very small population, and even smaller population who live at home.
So we were the residential school working group, and this is our idea.
And it seems that many people wear many different hats, and they work many different jobs. And this model where you develop a core, and then you sort of develop these rings around it.
A data researcher, somebody who is there to specifically research data.
And you involve people at different levels is extremely important, because it allows for people to stay fresh, because they don't have to be involved in everything. They can be involved at different levels. And looking back on this week, for me, that's something that's really, really important, that you are able to to really give what you can at the level that you can give at?
After this program, this training, what I took was all the King's men couldn't put Humpty Dumpty back together again, and I feel like I can now.
The traditional kind of research support is it's a single project. You do one thing, maybe a couple $100,000, and then, for 1 or 2 years, and it's finished. You're back to square one. This is called a team grant, which actually allows you to build a team of different people from different institutions, and also partner with community organizations, and to build something that is not just doing research, collecting data, but also to be involved in training, in building regional capacity. And so I saw this as a great opportunity, and for the North, because I think that as most people know, that the North doesn't have a lot of infrastructure. We don't have a good system of keeping track of what kind of diseases, how the burden of some of the illnesses, and also the lack of people with training in research.
So what you can do now is you can look.
The communities have never had an opportunity to really go and identify their priorities in the community. We've always seen other researchers or other people coming in, whether it be Health Canada programs or any type of programs that have good intentions in mind, but the priorities haven't come from the grassroots and haven't come from the community. So by the communities identifying what priorities are there, it's a starting point for them to take ownership and control over their own health programs and build a better community.
I think this course would be a great asset to a lot of First Nation organizations, governments, nonprofits, just in the process of planning, not only in health field, but in many other aspects.
And then some of the factors we talked about that contribute to food security or food insecurity, really, in this.
All the participants in this spring school have been working through each step of a planning process so that they understand how it works. And we've gone through the pre-planning step, which involves figuring out who you need to work with and who the stakeholders are in the issue that you're concerned about, and how you would find the people that you need to work with in your core group in order to do the planning.
Well, first of all, I'd have find my core people, and then we'd have a meeting, and then I'd like to introduce those plans to the community and have say a dinner, bring them together and explain what program I'm going to be working on, and I try to have the people buy into it.
This is our idea of a circle, and in the center we have our core, and residential school issue and topic involves so many other aspects of health, of well-being, of lifestyle, of everything. So it was really hard for us to get a core this small.
And then the second step is a situational analysis. So people are thinking about what they can learn from the data, what they can learn from literature, what they can learn by talking to people in the community, and figuring out which organizations might be good partners for the work that they want to do. And all of that information, not just the numbers, but also the information from talking to other people and figuring out who else has a mandate or a vision in this area, that all comes together in the situational analysis.
Our objectives are that we wanted all community members in our communities harvesting and preserving and storing traditional food. And our indicators to see if that was successful or not is that we're going to see.
And from that, people get a sense of what might be possible in their community to go to the next step. So at the end of that step, the participants identify some ideas for the projects or the programs they want to do.
I haven't done any diabetes awareness in our community yet because I have very little knowledge. I didn't know who to contact, and now I have some contacts I can call and say, I'd like to do this in our community, and a presentation. So it's needed, and community members have been asking for it. So
the next step, the third step, is creating goals and objectives. And it's a tricky step because people have to really think about the outcomes and results that they want to see in place in the future.
And the indicators of that would be communities have elder endorsed healing strategies, and then survivors have started their healing process. So that would be an indicator of one of the objectives that we would like to see.
The participants in this spring school were terrific at developing a sense of the outcomes and the results that they wanted to see in place for the issues that they're working on.
We're looking at taking some food and getting the fat content and getting a tub of lard and putting that on so it's visual for our First Nations. They can actually see how much fat is in this piece of bannock that they're eating, or how much fat is in the French fries that they're eating, or the ice cream that they're buying. And so it's more visual for them, and they have better understanding about the fat content. I really like that idea.
And the fourth step is developing strategies and activities. And most people like this step because they're actors and doers, and they're the people out in the community trying to make things happen. So that's how people think. They're keen about the actions and the strategies. So this step is usually moves forward pretty quickly.
You can't really go to a supermarket and buy, traditional foods. So we're trying to do that because it's healthier for our First Nations. So we're trying to provide some sort of freezer for them that they can access so that they're eating a little bit healthier, even if it's once or twice a year.
And then the fifth step is developing indicators, and that's to make sure that we can measure the goals and objectives and the strategies and activities that we've developed. And it's a hard step because you have to think about how you're going to measure things, and sometimes the ideas that you have are not easily measured, and so that's something we have to think about when we're going through that step. So the idea in the spring school is that each participant is working in a small group, in the same small group all week, going through each of these steps and working on an issue that's of particular interest or concern to them, that would be something that could be directly applied in their community. So the idea is that working through each of these steps, they're actually creating a plan, or most of a plan, and they get the idea of how to work through the planning process, and then what it can look like when you're working it through. So then I think it's much easier to know how to apply it when you actually get back to your community. So one of the ideas of the spring school is it's not just academic training about what planning is. It's actually doing the planning so that you can really feel what it's like to do that kind of planning, and then hopefully some parts of that can be transferred back into the community, and we can do something about creating some action and interventions that will address some of these issues that big issues that people have, big concerns that people have.
A dream for my community would be to have a holistically healthy community where people are laughing and smiling because they feel good, and where people's basic needs are met, where people don't have to struggle with past issues with abuse or addictions, where there's an open forum for them to discuss those things.
You can now actually turn this into reality. That the plan is entirely done by, the people up here in Whitehorse, and then with some technical advice from Suzanne Jackson. So I'm very happy to see that actually so many people coming from so many communities, and actually sitting down, enjoying learning. I think it's very exciting to see people eager to learn and to learn new skills, and what's important is they bring ideas from the community, and then go translate it into some project and some programs, and hopefully they'll go back and then they'll take the next step.
Well, the trouble is, being a small community, it's resources, human resources. So there's so many things on my plate. What I need is feedback, a follow-up from this. So I need to also, all the delegates that came here, I need to have a team. We should all work together, and we should we all worked on different areas, and so if we networked and shared our procedures or how we're doing, then then we all can stay focused, and then we don't lose track of this training.
I really think that our communities are blessed for the dedication from our workers. It's great to see the capacity in which we're going forward in the subject of health.
Thank you very much. Cheese.
This is the first spring school, and I see it it probably needs to happen more. One is not enough, and what I would recommend is that more funds be allocated north to start training our own people at the community level, and that way each community can have their own researcher, or else we could have a core group here in the Yukon, Nunavut or NWT, and that way it'll network with across Canada, or else with Ottawa, and I would like to see that for our future.
It's about having a team and not being alone, you know. So I think that would be a great asset.